Hi, Dr. John Torres on Daily Doc, talking about headlines that you've probably seen over the past week and giving you some information beyond those headlines, giving you what exactly that means and what the information means for you, and hopefully sending you off with some information that you can use to keep yourself, your family, your loved ones, your community, your friends as healthy as possible, and hopefully help get through this pandemic sooner rather than later. So cover a couple of those headlines and then answer questions you have. And you guys do always have fantastic questions. Please send them our way. I'll get to as many of those as I can. But let me start with the headlines first. And the first headline I want to talk about are the variants that are out there. And that still is in the headline. I talked about it a few days ago. It's still in the headlines this week, and for a couple of reasons. Number one, up until now, we've talked about 3 different variants. Well, all 3 of those variants have now been discovered here in the U.S., which has some experts concerned, but luckily, they're very isolated cases at this point for 2 of them. And I'll explain in a minute. So one thing I want to talk about is the nomenclature you're going to hear. You're going to hear it switching a little bit, because right now people are saying, instead of calling it what we've called it up until now, the UK variant, the South African variant, the Brazil variant. The reason they've been called that is because that's the place they originated from. To kind of delve back into a little bit of a story, back in the 90s when I was in residency in Albuquerque, New Mexico, we actually had a new virus crop up. It was called a hantavirus, which is a cousin to what's called a Hantan virus, which was detected in the Korean War back in Korea. The problem is when it was detected, it was a new virus. It caused a huge mortality, 70% mortality in people that were afflicted. Luckily, it was hard for people to catch. They caught it from deer mouse droppings, and so they had to be in certain areas to catch it. And it was young, athletic people that typically had problems with it. Well, we called it the Four Corners virus because that's where it originated, the 4 corners of the United States, which is Colorado, Utah, Arizona, and New Mexico. Well, the problem is Four Corners started having a real hard time with, especially tourism, because they're saying, you have this name associated with it, and people don't want to go there. So it eventually delved down into what they call the sin nombre virus, which is Spanish for no-name virus, because they really couldn't figure out another way to name it. Well, fast forward now to what's going on right now. And what's happening now, again, we have these nomenclatures of the places it originated from. But these places are saying, and rightfully so, hey, this isn't a whole lot different than calling it the China virus. It gives that bad connotation, so let's switch to the scientific name. And if you listen to the White House briefing today, they use those scientific names to go ahead and talk about the viruses. So that's what I'm going to do. It's going to be a little confusing at first, but essentially the 3 we're talking about. The B117, which was a virus that originated in the UK. The B1351, which is the virus that originated in South Africa, and the P1, which is the virus that originated in Brazil. So you're going to hear about the B117, the B1351, and the P1. Those are the 3 variants that are out there. Now, the honesty of it is, viruses create variants as they infect people, and that happens thousands of times a year. Most of those variants are what we call deleterious. In other words, they're mutated changes in the genomic sequencing of the virus that makes it so that they don't work quite as well trying to infect us. And for us, that's good. But every now and then, this happens where it turns out to be an advantage for the virus. In other words, it can infect us more. And that's how these viruses thrive. And if you look here at essentially what my model of the coronavirus, you can see on the end here, these are the spike proteins. The spike proteins are what allow it to attach to the cell. When it attaches to the cell, then the RNA particles that are inside, which is the working part of the virus, gets absorbed into the cell, and that's how it does its business and how it replicates and how it produces to go on and infect more cells and then eventually infect more people as well. So if they can change the way these spike proteins attach to the cell, there's receptors called ACE2 receptors. If it can change how well it latches onto those ACE2 receptors, then it can stay on there longer, it can get on there quicker, and it can get its virus into the cell faster, and that means it's going to become more contagious, more efficacious, as we call it, more infectious. Now, I talked to an expert yesterday, and he was I thought he brought up a very good point. He said, one of the nice things about coronavirus is it really needs these spike proteins to live, to propagate and live. So it can't change these spike proteins too much. And so experts are looking at these variants, but they're hopeful that the variants won't change that much to make the vaccines that unreliable that we have to go ahead and go back to square one. And I'll talk about that in a minute. But when it comes to these variants, again, the B117, which originated in the UK, has been here in the United States for a while. And right now, it's in 29 states and Puerto Rico. And so you might hear it's in 30 states, it's in 29 states in Puerto Rico, and those are just the ones we know about. So more than likely, community spread is much, much higher. Now, the issue with the B117, the one out of the UK, is that it basically is more contagious, meaning I can catch it and spread it more, but it's not any deadlier than what we call the coronavirus, the wild type that's been here in the U.S. For the last few months. But now looking at the other ones, we have the B1351, originated out of South Africa. That's the one that has experts concerned because it looks like not only is it more contagious, but it also could be deadlier, could cause more complications, and could cause issues with the vaccines, which I'll talk about in a minute. That here was detected in South Carolina just over the last couple of days. There's been 2 cases there. The cases are separated geographically. They've never come in contact with each other. So the concern is there's some community spread. They haven't seen it in the community to that level. But the honesty of it is, our surveillance system is not that robust yet, but it certainly is coming on strong. And so hopefully we'll get a better idea of what's going on there. And then the P1, which is the Brazilian one, also it's similar to the South African one, and it has experts a little bit concerned because it looks like it might cause more complications. That has only been detected in 1 person in Minneapolis. So again, this is one of those things that we know it's here. Hopefully they contain it well enough to where it doesn't spread. But the best thing we can all do to help ourselves and to help these variants from not coming on more and more is protect ourselves from getting the virus, because the way these variants happen is the virus gets into our body. When that RNA gets into the cell, it basically makes more of itself. And when it does that, it's like a typewriter basically typing out the code. And the typewriter every now and then is going to make mistakes. And when it makes mistakes, again, sometimes they're not good mistakes for the virus. Sometimes they are good mistakes for the virus. That doesn't happen unless they're inside our cells. So not letting them get in our cells, meaning not letting them get in our bodies by doing those things that we talk about all the time. Wearing a mask, social distancing, washing your hands, avoiding large crowds can help get those variants under control. But now let's look at the vaccine, because today Johnson & Johnson came out with some information about their vaccine. And that's the big vaccine news going on today. What they said is when they looked at their vaccine, and the thing you have to remember is Johnson & Johnson is a 1-dose vaccine versus Pfizer and Moderna, which are both 2-dose vaccines. So it's a 1-dose vaccine. They studied it here in the United States. They studied it in Latin America and South Africa. And what they found is overall, here in the U.S., 72% effective against fighting the virus. Now, that doesn't sound like much. And by that, what they meant was, and I said fighting the virus, but what they meant was it's 72% effective at preventing moderate to severe illness from coronavirus. Then they went ahead and looked forward and said, okay, now it's 85% effective at preventing severe illness from coronavirus. And to add icing to that cake, they also said, looking at all the data, anybody who got coronavirus, anybody who got the vaccine, 28 days later, none of them ended up in a hospital. None of them ended up dying from coronavirus. So essentially, it gave 100% protection from severe illness or dying from coronavirus, which is extremely important because at the end of the day, although none of us want to get sick from coronavirus, getting those mild symptoms is something that we do worry about, but not as much as getting those severe symptoms, complications, and dying from the virus. And this vaccine does a very good job. Now, when you hear the numbers out there, you're going to hear, oh my gosh, 72% Johnson & Johnson versus 95% Pfizer, 94.1% Moderna. It's comparing apples to oranges because Pfizer and Moderna looked at overall COVID illnesses. That's everything from mild, and we're talking maybe you had a headache, fatigue, lost your sense of smell, all the way to severe complications in the ICU, on a ventilator, all the way to dying. They looked at that as well, whereas Johnson & Johnson looked specifically at those moderate to severe symptoms, and particularly at severe symptoms and dying from coronavirus. And so essentially what I tell people all the time is when it comes to looking at the virus and which one you want to get, they all have advantages, they all have disadvantages. Johnson & Johnson, the advantages are it only takes refrigeration. It doesn't have to have the ultra-cold storage. It's easy to transport and get to other areas, especially more rural areas, and it's a 1-shot dose. It's not a 2-shot dose regime. And so for people who don't want a second shot, can't take a second shot, logistically it's hard to get them a second shot, as in the homeless population, then this will come in very, very handy at getting the coronavirus under control in that population and in that group. And so if you're offered Johnson & Johnson, go ahead and take it. And what I tell people all the time is if you're offered the vaccine, the first vaccine you're offered is the best vaccine for you because you want to get it as soon as possible. What you don't want to do is wait 3 or 4 months for one you think might be better. And in that time period, you're risking yourself getting coronavirus, getting the complications, and frankly, dying from coronavirus. Not something you want to have happen. And so again, looking at the vaccines, right now we have one more tool in our tool bag. We have Pfizer, we have Moderna, and we have Johnson & Johnson, which is going to seek the emergency use authorization probably next week or the week after. They say they can come out with a large manufacturing production going on right away, 100 million doses by the end of the summer. And so remember, those 100 million doses are 100 million people vaccinated versus the other ones where 100 million doses would only be 50 million people vaccinated. So that's good to know. And then looking at numbers here real quick, just to let us know where we are when it comes to vaccines. Right now, there have been almost 50 million doses distributed. 26 million people have gotten the vaccine. And of those, some of those are duplicates that have gotten their second dose. But the first dose ones, 21 million. So 21 million, that's almost 10% of the adult population in the United States has gotten the vaccine. Now, I know there are vaccine issues, there are vaccine problems, and that's across the country. Trying to get your vaccine, trying to find out when you're eligible, trying to find out what to do when you're eligible and who to go to. And what they're doing is they're rolling out a few things over the next couple of weeks. FEMA is going to come into play, and FEMA is going to open up some centers, community centers, where they can give vaccinations. There are mass vaccination events taking place across the country in different areas. But that having been said, there are still some issues. And one of the things I'm adamant about is talking to them about making sure instead of what's happened up until now, which is where people have to go to the vaccine, they have to do a lot of legwork, a lot of computer work to try and find out where they can get the vaccine, time it perfectly, making sure they're there, making sure they can come back. Instead of the people having to go to the vaccine, what we need is the vaccine to go to people, meaning it needs to go into the communities. It needs to go into those underserved communities. It needs to get into the homeless population. Because if we can't get herd immunity across the country, we're not going to get herd immunity anywhere. It doesn't do any good to have herd immunity in your community and the community next door not having it. Because of all the interactions, it is just going to spread. And the same thing goes for global herd immunity. That's a problem that's going to eventually be worked on here, and it's being worked on now, but with the vaccines and the way the rollout's going across the world, they're having similar issues that we're having. And so it's going to take a while, take a little bit of time to untie this knot and get it so that we have the straight line to getting vaccine to people. So that way we can get this pandemic under control. And as Dr. Fauci said, if we can get enough people vaccinated by the end of the summer, between 70 and 80%, then by the fall, we can hopefully get back to a sort of more normal life, meaning we can start doing those things, we can start traveling, we can start those other things that we've wanted to do for the past year, and by then it'll be a year and a half into this. So hopefully, knock on wood, we can end up doing that, but it's going to take all our parts to make sure that happens. And so again, looking at the different headlines, what are the variants? All three of those variants, the B117, the B1351, and the P1 are all here in the United States, but hopefully not spreading that much. We know the B117 is, but hopefully the other two, the one out of South Africa, the one out of Brazil, are being contained because it's important. And the other thing we found out, I forgot to mention, is the vaccines. Now the vaccines, Pfizer and Moderna has said in the lab, the vaccines seem to work okay against some of the mutations that are associated with these variants. Not all the mutations, but some of the mutations, which is good news, meaning it'll probably work. Johnson & Johnson is the first one to actually go into an area where there's a high number of these. They were down in South Africa. Of the people in South Africa that contacted coronavirus, 95% of them had that that B1351 variant, the variant out of South Africa. So they found out that their vaccine was fairly effective, 57% against that. But the thing you have to remember, when you see that number of effectiveness, that's overall at preventing that severe complications and death. But also you have to realize that what it can do is it can basically, as we say, it can turn coronavirus into an outpatient type illness, like it is with the flu, where basically you get the flu and you feel under the weather for a few days and then you pop back up and you're doing okay. That is a good place to be, and then we can work on getting it down to where essentially we have a cure for coronavirus. So that's the variants, that's the vaccines, and again, the numbers of vaccines out there. It is happening. It's happening a lot slower than anybody wants, getting people vaccinated, and I think that'll continue to happen for the next couple of weeks, but hopefully they'll start rolling out more and more vaccines, and more people can get them. Let me see if you have any questions.
Is the shot free?
So the shot is free, and up until now what the CDC has said is getting the shot is free And it's possible that the healthcare provider, whoever's doing it, be it a pharmacy, be it a doctor's office, wherever, could basically charge an administration fee. In other words, fee for some of the equipment or the time it takes, the nurse they have to pay to administer the shot or the storage they have to do, those types of things. Well, the Biden administration is now saying they're going to eliminate that as well. They're going to make it free across the board, no out-of-pocket expenses for the vaccine. So yes, the vaccine is free.
Is it safe to take the vaccine for COVID when you've already had COVID?
Yeah, and this is a great question. And the question is, if you've had COVID, is it safe to take the vaccine? I'll split this into a couple different areas. Number one, if you have COVID right now, you actively have COVID, you're diagnosed within the last few days, and you're in isolation trying to get through COVID, what the CDC says is wait till you get through your isolation, which is a 10-day period. Make sure your symptoms are getting better, you're fever-free for 24 hours, all the criteria you need. And then after that, go ahead and get your vaccine started at that point. If you got a vaccine first and then ended up getting COVID before you got your second vaccine, which happens to some people because that first vaccine doesn't give us the amount of protection we'd like, then they say the same thing, wait for you to get through your isolation, recover from COVID, and then get it. Now, the important part is if you do delay that second dose, you want to make sure you get a second dose within 6 weeks or 42 days after getting that first dose. And that's the criteria the CDC has come out with. So that's if you actively have it right now. If you had it in the past, what the CDC says is that first 90 days, you have some natural immunity to coronavirus. After that, we think it goes away. We're not sure how strong it is. And so they say if you want, and basically what they're saying is if you want to hold off so you can make room for other people to get it who are at high risk, then you can hold off, but only for 90 days. And you need to get it after that 90 days or as close to the end of that 90 days as you can, because we don't know if you have protection after that. And the other one is if you have COVID recently, but essentially if you had COVID 2 weeks ago and you want to get it now, you can get it now. But if you had COVID recently, like a few weeks ago, and you got monoclonal antibodies or convalescent plasma, then you need to wait that 90 days as well, because the problem is it won't be harmful to get the vaccine, but because you have those antibodies in there from the monoclonal antibodies or the convalescent plasma, it could interfere with your immune response to the vaccine. So essentially the vaccine won't give you the robust response we want it to. So it won't protect you as much because your immune system's already occupied with what it has going on right now. So they want you to wait that 3 months. So hopefully that answers that question.
Does the vaccine interact with medications for diabetes, blood pressure, cholesterol, things like that?
Yeah, so the question, and this is a great question too, does the vaccine interact with medications? Diabetes, high blood pressure, cholesterol medications, any of those? No, it does not interfere with medications. Now, the only caveat to this, if you are on any type of chemotherapeutic medication, you want to talk to your oncologist or your doctor about that, just to make sure that mainly has to do with how your immune system is responding. But as far as the vaccines and medications, no interference at all. Now, when you get these vaccines, and Johnson & Johnson came out and said around 9% of people had fevers in their vaccines, but they didn't mention any of the other side effects. We're going to wait for the data to drop for the emergency use authorization to find out exactly what the side effects are. But my guess, they're going to be similar to Pfizer and Moderna, which is the arm soreness, the fatigue, the muscle aches, the headache. Usually goes away after a day and a half to 2 days, and most people say that. Now, Pfizer, Moderna, and Johnson & Johnson all said in their trials they saw no evidence of anaphylaxis. None of their patients had anaphylaxis in the trials. If you remember from Pfizer and Moderna, the same thing happened, but then afterwards when people were getting them, they ended up having some cases of anaphylaxis. But again, the rate of anaphylaxis from these vaccines is very, very low. As a matter of fact, it is 0.001%. 11 out of a million people get this. And if you look again at the numbers here, we have astronomical numbers of 25 million cases of coronavirus, over 400,000 deaths from coronavirus, versus a vaccine, which again, we've had 11 per million cases of people having anaphylactic reaction, and for the most part, they've recovered well.
Will you get the vaccine?
I've already gotten the vaccine. I got my first dose about a week ago, about a week and a half ago, and I'm waiting on my next vaccine, the second dose, which will be in about a week and a half. And so, yeah, I'm looking forward to that second dose. Right now, I know with the first dose, it gives me some protection. I'm almost at that 2-week point for my second dose, with my first dose. With the first dose, according to what they determine, you get around 57% protection, but they don't know how long that lasts because they only studied people up until they got their second dose at day 21. And so at day 21, I'm going to get my second dose. I got the Pfizer, And then after that, 2 weeks later, so remember, it takes 2 weeks for your immune system to fully kick in, I'll be at that 95% protection level. And so that's going to give me a lot of protection. On top of that, I'm still going to wear my mask. I'm still going to social distance. I'm still going to wash my hands because we know that the community spread is still there. We want to make sure that gets under control. But yes, I've gotten my vaccine. I had arm soreness. I was a little bit tired the next day. I don't know if that was because of the vaccine or because of the fact that every time I rolled over on my arm, it hurt and I would wake up. But that only lasted a day and then good to go after that. And I'll let you know about the second shot. I'm going to do a Facebook Live getting the second shot. I did one getting the first shot. And what most people say is after the second shot, their symptoms seem to be a little more intense than they were after the first shot, but they're still basically the same ones I talked about. And they typically go away after a day and a half or 2 days as well.
Does the regular COVID test detect the new variants?
So does a regular COVID test detect a new variant? And the answer is yes, for the most part. Now, right now, what they're doing is they're looking at that deeply to make sure that it's detecting them all they want and all they need to, because you're right. Basically what it is since, again, it's on that spike protein that the mutation has taken place. If the test is actually looking for that spike protein to diagnose it with coronavirus, then if it changes enough, that could be an issue. But to date, that has not been an issue. Now, the way they find these variants is they basically take these tests. In some people, they double swab them. One swab will go for either the PCR or the rapid test, and then the other swab will go to the lab if they're doing that surveillance, and they'll look at that. They'll do a genetic sampling of that, and they'll look to determine what variant is there. And if they find these variants that we know are coming into the country, then they'll set up the alarm saying, hey, we have more and more problems with these variants. We need to really clamp down on things. But as of now, again, when I talk about the B1351, which is the one out of South Africa, we've had 2 cases in South Carolina. The P1, the one out of Brazil, we've had 1 case in Minneapolis. But if you look at the B117, the one out of the UK, it's in 29 states and Puerto Rico right now. And so we think the community spread is pretty wide. By some estimates, it's going to be the dominant one by March timeframe here in the country, much like it is in other places. The good news is the vaccines work against it, therapeutics work against it, but we need to do our part too to make sure that we keep these variants under control. Thank you for your questions. They've been fantastic. And again, going over, we talked about the variants and the 3 different ones that are there, the fact that we can help keep those under control by masking, social distancing, washing our hands, avoiding large groups. Vaccine rollout is happening. Johnson & Johnson today came out with their information, which looked great. And the end game here is to protect lives, save lives, and it does a great job of doing that. And then on top of that, they're also going to be coming out with 100 million doses by the end of the summer. And so it's going to give us one more tool in our tool bag. And as I tell people all the time, there's no one vaccine, there's no one therapeutic, there's no one anything that's going to get this pandemic under control. It's going to take a combination of all those tools in our tool bag. And this is one more that can thankfully help us. The next one we think is Novavax, which is we believe is coming probably in the springtime when they'll be seeking their emergency use authorization. And then on top of that, just looking at the vaccine rollout, it still is complicated. It's still difficult to get a vaccine, but hopefully over the next couple of weeks, they'll become easier. But thank you very much for joining me, and I hope you have a fantastic weekend. And as always, I hope you stay healthy. Hope you stay happy.
Are you a fan of our videos? Be sure to subscribe to Worldwide Campus News and Entertainment. Then ring the bell to see all notifications about the new videos and the latest video.